drowsiness now or sometimes. And you in a class, if you are hearing a lesson, if you feel drowsy, what do? What? Okay. Then, do all people remember the smell of a rose? How it smells, right? Jasmine, yes. And all the experience of playing in a park with all your friends. Do you all remember? Yes. And what is the sensation if a pinprick is? Hello. What is the sensation if a pinprick is pricked to you? So what is the sensation it causes? Pleasant sensation or painful sensation? Painful. Yes, painful sensation. So all this, the smell of a rose you remember, the playing in the ground you remember, and the various experiences while the pin is pricked into your hand or in the foot you remember. So all these experiences and all these memories, these are all taken care of what? Our brain. Okay, all these are possible because of our brain only. So it is very important structure, and so we should know something about our brain, right? So can anyone tell me how does the brain works? It's a very complicated question, no? So no, you all can't answer that. I will make it simple, okay? Yeah. So don't worry, it's a complex diagram. So brain and spinal cord. So brain is present in the shell. What is this called? Skull. Controls the vision. Okay. The eyes are front, but vision is controlled. The vision center is present back. Okay. And there is a part called cerebellum. If you must have read or not, I don't know. This small part which is present below the inferior part of the brain, cerebellum. It controls our posture and balance. Suppose if the person doesn't have his cerebellum intact, then while walking he will be just going like this. He won't be able to walk properly. So that is the function of cerebellum. It maintains our balance. Okay? And now this, what I have written, see, the hand, hip, leg, trunk, you can read. So all these are areas which are controlled by those parts. And suppose if the patient smell area is damaged, the person won't be able to smell it. I told you regarding the smell of a rose, the smell of jasmine. Suppose this part is not there, it is damaged, the person won't be able to smell anything and won't be able to remember the smell also. Okay?
Traumatic injury. Atherosclerosis is the hardening of the walls of the arteries and the narrowing of the space inside them due to the slow buildup of plaque inside the arteries. Plaque is made up of deposits of fat, cholesterol, calcium, and other substances circulating in the blood. Plaques are of two types, hard and soft. Hard or stable plaques have a relatively thick covering and cause artery walls to thicken and harden, and may cause a larger blockage in the artery. When the blood clot that has formed in the brain blocks an artery, this type of stroke is called thrombotic. A clot formed elsewhere in the body can also dislodge, travel to the brain, and block an artery there. This type of stroke is called embolic. Hemorrhagic stroke is caused by bleeding from the ruptured blood vessel in or near the brain. Bleeding inside the brain is called intracerebral hemorrhage. The bleeding results in a sudden increase in pressure, causing tissue damage. Other parts of the brain may not get enough oxygen and can also be damaged. This type of stroke is most often caused by high blood pressure. It may also be caused by head injury, malformed blood vessels, stroke, subarachnoid hemorrhage, a blood vessel ruptures between the brain and its lining. The part of the lining surrounding the brain fills with blood, leading to tissue damage. This is usually caused by an aneurysm, a weak spot in an artery where the wall has become thin and bulges out. Because different parts of the brain control different parts of the body, symptoms vary from person to person and depend on how severe the stroke is. Symptoms usually come on suddenly. The person may feel weak or numb on one side of the body, often in the face, arm, or leg. They may have trouble speaking and understanding others. They may have problems seeing or hearing, or lose their balance and coordination. They may feel dizzy or have a severe headache. Stroke is a medical emergency, and the emergency services should be called if a person seems to be having a stroke, to get them to a hospital as fast as possible.
Thank you, ma'am. Thanks a lot. Thanks for a wonderful message and the knowledge you have shared. I just ask the kids who have come from Mount Leo, please take a line, and there is a bus waiting for you all. You can face the school. Okay. Name the school Mount Leo Trans Children.